Hi, my name is Alan Lynn, and today I'm going to be talking to you guys about health insurance and why it's important that we reform it. Now, today I walked by a bunch of kids playing, ultimate frisbee and football, and I realized, why would a bunch of these 20-year-old college kids care about health insurance? They think that's for old people, way down the road. So I decided to change my presentation a little bit to cater to my audience, these guys. And I decided that researching health insurance is kind of like that club that we see all the time running around, and we're kind of interested in it, but we never really get the motivation to actually join. And as a result, we wait 4 years later and we find out really quickly that it's not okay to shoot at people with Nerf guns outside of college. And so this is kind of similar to healthcare in that we realize it's something that it's important and we have to learn about it. However, we never really try until we actually need it, and we find out really quickly that it's not so great in the United States. So what is the healthcare system like in the United States? Well, it's capitalist. It's run by a couple of privatized for-profit health insurance companies, and there's very little or none government involvement. So here's another analogy I like to use. There's always that club that always asks us to pay their dues for funding their adventures and whatnot. However, we really know what those adventures are all about. The privatized healthcare system is not that different. Here's a chart that displays two different forms of healthcare: Medicare and private healthcare. Now, Medicare is run by the government, and it shows that 97.9% of the money that you put into Medicare will go directly towards medical treatments. However, the private health industry is very different. 19% of the money that you put in will go directly towards CEO profits, advertising campaigns, or just company profits, and that's exactly where we don't want this money to go. It's not uncommon to see health insurance companies actively seeking out premeditated conditions that would exempt them from providing their customers care just so they can improve their profits. As a result, 16.3% of Americans in 2010 were reported without health insurance. That's 50 million people in the United States without health care. And that's unacceptable. Why does the free market let this happen? If there's a bad business practice, ideally the free market should be able to solve it. However, this isn't the case because in an American Medical Association study, they found that 70% of the markets for health insurance, there isn't any competition, so there's really no incentive to change a bad business practice. As a result of all this, healthcare costs have skyrocketed in the United States. We pay thousands of dollars more than every other country, and logically we would assume if we paid this much money for our healthcare, we would get the best possible care. However, according to the World Health Organization, the United States ranks only 37th out of 191 countries. This leaves us behind countries like France, Germany, and Japan. So what do these countries have that we don't? Why do they pay so much less for their healthcare and yet the quality of their care is so much better? Are their doctors just nicer and better? I don't think so. I think the reason why their healthcare quality is so much better can be summed up in one picture: the European health insurance card. Now basically this is kind of like a college ID in that it'll pay for your medical treatments instead of your food and your snacks. So basically what happens is when you go over to Europe and say you're sick and you need to be hospitalized, you show them this card and they'll give you the exact same treatment that they would give their own citizens for the exact same cost. Now what this normally translates into is that you don't even have to pay for your medical treatment, or you pay for the treatment at an extremely reduced cost. Now, how does the European government do this for all their citizens all the time? They get involved in their healthcare system. They're heavily involved in their healthcare system by monitoring and making sure that, one, the companies are mostly non-profit, two, they're not allowed to turn away people because they have pre-existing conditions, and three, they make sure that the companies compete with each other to gain more customers. Now, a lot of Republicans will have you believe that the second government gets involved, it becomes a socialist system. This is clearly not true. These companies in Europe all have to fight with each other to try to improve their care, to improve the quality of their care for their customers for cheaper prices, because the government does a good job of monitoring them. They have capitalism with just the right amount of government involvement. Now, recently President Obama signed the Affordable Care Act. Now, what this serves to do is bring over some of the perks we've seen from Europe and try to bring them over here to the United States. And this is a terrific idea. Now, I implore you college students to use your voice, to use your votes, to use your actions to show support for the Affordable Care Act, because we can make millions of lives better today. Thank you.